Hi, my name is Michelle Jones. I'm a physical therapist with DCH Home Health. Today I'd like to talk a little bit to the caregivers as well as persons who use assistive devices on how to maximize safety and minimize your fall potential. Falls account for many dollars in health care and also increased risk of dying and permanent morbidity. So we want to help you to learn how to minimize your fall risk. First of all, when you're a caregiver and you're helping an elderly person, repetition is very important. Every time that you see the person getting ready to get out of their wheelchair, you want to stress several things. One, you want them always to lift up their leg rests. They can use their foot to kick it up, but they need to lift up their leg rests. If they're trying to get close to a bed or a toilet, you need to also stress removing that leg rest. A lot of people do not want to remove their leg rest because they don't want to have to fool with it and put it back on but this is a barrier to safety. If you have to get around the leg rest to get on the pot when you're in a hurry, this is a big chance you're going to fall. The other thing is, so getting the leg rest out of the way is important. Locking the brakes. Always stress to the person, lock your brakes. Eventually, they're going to get tired of hearing you say it, and they may just start locking the brakes. If you're having a patient as a caregiver that is very debilitated and can't come to a complete stand and to get onto a bedside commode, you may want to remove the armrest so that as you do a pivot type of stand with them, they have one less barrier. Any barrier that you can avoid in helping somebody transition from one surface to another, such as the wheelchair to a bedside commode, getting rid of the barrier decreases the fall risk. Also, when a person goes to stand up, a lot of people don't realize this, but you always want to encourage the patient to stand up by pushing up from the handles. As you can tell, this is called a desktop handle. This handle is meant so you can easily get under a table. Well, if you turn the handle around and click it in, it gives the person a much better place to place their hands to push up to standing. I always tell my patients and the caregivers, you need to push up both hands on the chair to come to standing. I'm going to sit in the chair and show you how to safely come to stand. We always tell patients in home care and in the hospitals to first wiggle those hips out, one hip at a time. You want to wiggle your hips out so that you can get a firm base of support on the floor. Place your hands on the chair, bring your nose over your toes so that you displace your center of gravity forward. Patients who have fallen in the past or who are afraid of falling, try to stand up like this, and all you do is go back down. You have to show them through repetition and standing close, holding on to them, that bringing their nose over their toes and then grab the walker, come straight, is what's going to really help to prevent a fall. We have gait belts. Actually, here at DCH, you can purchase a gait belt with our DME. If you have a patient who's just been in the hospital that is weak, your family member, get a gait belt, wrap it around them, then you have something to hold on to rather than their pajamas, which are slippery. This is a huge gait belt. Some are cloth. DCH has the rainbow gait belts. But then you have a firm hold, and when you're encouraging them to bring their weight forward, you hold the gait belt and kind of rock with them to come to standing. It's a very good tool. A lot of patients nowadays are using two-wheel walkers. When you move this wheelchair a little bit, hopefully before a patient goes home, they get set up at the proper height for a walker. You don't want the walker too low or too high. A walker at the proper height meets the handles at the hip bone. You find the person's hip bone, and if it's where the handles are, it's at the right level. You always want to encourage a patient to slide that walker. It's on wheels, slide it. People are afraid that the wheels will get away from them. This is very safe. The wheels don't get away from you. So you slide it and you step, bad leg, good leg. You never want the patient to step so that they're almost going over the walker or through the walker with their feet. It's left leg, or right leg, left leg. So when they're getting up from a wheelchair, you can either both hands here, come forward, my feet are flat on the ground, put your hand on here, come to standing. You'll see a lot of times patients want to do this. That tips the walker, increases your risk of falls. So at least one hand on the walker, one hand on the chair, or both hands on the chair for safety. When you have a cane, a lot of people, we're getting away from these in physical therapy, these quad canes, because people, when they walk with them, I'm going to have to raise this up, just like I mentioned, so that it's at my hip height. But a lot of times people walk with them, they never get all the legs of the walker down. Really what they need to do is plant it, bad leg, good leg. That slows you down so much, people don't like to do that. So I like to get away from these. You either need to be on a walker still, or if you just need a really tiny balance support, go to the cane, a straight cane. Once again, you always want to adjust it to the right height. People always think that the cane should be on their bad leg side. No, cane goes on the opposite side so that when you move the cane, you're balancing cane and bad leg. This becomes your added pillar. If you put it on the cane on your bad leg side, you're kind of leaning into it. You haven't increased your base of support like you do with the cane opposite the bad leg. And one final thing I want to stress with, everybody's getting the new Rollator walkers. Some have handles that come up with squeeze brakes. These have brakes right here. They're a good tool. It's just that if your patient has poor balance and walkers tend to get away from them, having the 4 wheels is not a good idea. You really want to talk to your physical therapist about, is this 4-wheel walker going to be safe for this patient? If the patient doesn't have a balance issue but has more of an endurance problem, a chronic obstructive pulmonary disease person, or someone that lives alone, likes to have a walker, but also has to get dishes out of the cupboard and laundry, this becomes your little laundry holder, your dish holder, and it's like you're pushing your grocery cart. But you always want to stress to them before they get up, lock their brakes, and then to stand up. And when they're going to sit down, you want to lock the brakes before you turn around and have a seat. So, an ounce of prevention is worth a pound of cure. To summarize, just always repeat what the safety things that you want to get across to your patient. Even a dementia person can learn through repetition. So every time, lock your brakes, Sally, lock your brakes. And that's eventually going to have a good carryover. And if you have any questions about safety issues, feel free to contact a physical therapist at DCH, and we'll be happy to give you any information that might be helpful to you. Thank you.